my name is Drew Sexton. I'm a PGY2 here at Rush. As residents, there are 12 of us in each class. There's 36 total. Here at Rush, we do the majority of our rotations. We are a 60-bed emergency department. We see 74,000 patients a year, and we serve the west side of Chicago.
Hi everyone, my name is Callaway Pichette. I'm one of the PGY3s at Rush. I'm going to be talking about the rotation sites we go to. So obviously we rotate here at Rush a lot. So we do our EM rotations, some ICU rotations here, and it's a tertiary care academic center. So we see lots of complex patients with multiple chronic medical conditions and sometimes very rare diagnoses. So we work very closely with our specialists down in the ED when we have some of those patients with rare diagnoses. We also have a cancer center, so we see lots of cancer patients, overall lots of varying acuity, sicker patients, as well as just the normal bread and butter stuff of EM. We also rotate at some of the sister sites, so we go to Rush Oak Park, which is a smaller community hospital that's not too far away from downtown Rush. And the pace there is a little bit slower, but there's also a lot of normal EM stuff, so we see a variety of patients there and work with the doctors at that site. We also go out to Rush Copley, which is a bit of a drive, but it's totally worth it. It's a community site out in Aurora, if you're at all familiar with Chicago area. They also see some traumas there, so we work with the EM doctors there to see all of the traumas, all of the medical cases, and get a lot of variety and acuity there. And it's a really good practice site because you learn how to transfer patients, especially patients who need to go somewhere like downtown Rush for things like strokes. We also go to Mount Sinai, which is an urban community center on the south side of Chicago. There we see a lot of under-resourced patients, so lots of people with complex diagnoses that present very late in the course that you wouldn't see elsewhere. It's a level 1 trauma center, so we're always working with the trauma team, doing the airways on every trauma case that comes in. We go there all 3 years. We also rotate there on the trauma rotation as interns, so seeing all the trauma patients, managing them when they're admitted. And as seniors, PGY3s, we go there for the surgical ICU, lots of procedures, lots of acuity. Then our second year, we also go to Cook County or Stroger for trauma. There we work with the trauma surgeons and see all the patients that come in the trauma bay. I think that's it.
Hi, I'm Jeanette Lorm. I'm a first-year resident here at Rush. I just wanted to talk about why I love Chicago, why I wanted to be here for residency. Chicago is an extremely vibrant city. It's a great place to live and train. In terms of things to do in the city, there's an awesome art scene, music scene, sports scene. My favorite of all is all the restaurants and breweries. There's just such a huge diversity. There's always restaurants to explore. There's also a ton of recreation in Chicago, which is great. The lakefront's amazing. I love to bike and run along the lakefront. There's also boating and kayaking in the summer. It's a really awesome place and it's so accessible. That's one of the things I like about Chicago too, is you can bike everywhere. Public transit's really good. So it's a huge city, but you can get around really easily. Compared to other big cities on the east and west coast I've lived on, like I just love that big city but neighborhood feel that's super accessible.
I love the city because of the cultural diversity, and the food is really amazing here. And I also have the opportunity to go to the beach and also experience the many advantages of living in the city. Also, I got into cycling, so I'm pretty excited about that.
Hey guys, I'm Lauren. I'm one of the third years. Today I'm going to kind of talk to you a little bit about the culture and kind of what it is to be a resident here at Rush. So one of the best things that I think about our residency program is that we've really just tried to create this culture of being a family. One of the first things you do when you start here at Rush is we have an orientation month for you. During that whole month, every single weekday, you're going to be hanging out with your other co-interns, and it really kind of forms this bond between you and your other 11 co-interns. And also that there's these activities that we plan so that you can kind of meet the other residents and faculty and even nursing staff outside of the hospital. And it really just kind of creates this environment where you feel at welcome and you're forming these bonds. And I think that kind of shows throughout the program. That obviously continues as well. You get to hang out with your attendings after work occasionally. You can try to hang out with nursing staff. The residents try to get together as frequently as possible to kind of hang out. Luckily, there's a restaurant across the road from Rush that we have a tendency to frequent, especially after conferences if we can. And everyone's just pretty open to each other. I would say that my class is pretty close, and I can say that probably for the other classes as well. They're honestly my family, and they're going to be family for the rest of my life, and I can definitely say that about the majority of the attendings as well. We're just all really welcome and committed to each other and to help you out, and you can turn to anybody if you ever need anything. Another thing that we try to really focus on as well is wellness. Unfortunately, emergency medicine physicians experience burnout, and our program is trying to prevent that and promote wellness throughout our lives, as wellness in the emergency department while you're on other rotations and even just in general life. You're focused so much on your residency program and practicing medicine that other aspects of your life can fall to the wayside. But our program really tries to make sure that doesn't happen. They try to ask you about how other things are going, and if something does happen, they're super accommodating so that you can have a really great work-life balance. We also do wellness events where we try to do like pumpkin carving or hang out on a boat or get together for drinks or anything like that. And we just try to do all these activities so that you can just take a break and hang out with each other outside of the hospital, because medicine isn't the only thing that there is in life, and so we need a really good work-life balance. Another great thing about our program is the scheduling. So per year, you get 4 weeks of vacation off, so that really allows you to kind of travel and get to do what you want to do and gives you a really good break and relief from actually being in the hospital. Another thing that we get to do is during our ED months, we actually get 2 weekends off, or so 2 golden weekends. The scheduling team, the 2 chiefs and our APD who works with us really try to make sure that is something that actually happens for us. And I think that just shows that they are really trying to give us a really great work-life balance, because a lot of us have significant others or family members that are nearby, children where, usually they're the ones that get weekends off and they work weekdays. And therefore you can kind of, your schedules match up with them better. Also, another thing is during our ED months as well, you can ask for some specific days off. You can have up to 4 days requested to see if they can be approved, so that if life events do come up, you can try to ask for that off and go and participate with whatever events you want to do outside. And sometimes you can even group them together and maybe get a long weekend off.
Hi everybody, I'm Bill McDowell. I'm one of the 3rd years here at Rush. I'm going to talk to you about some of our off-service and selective rotations. I think it's a real strength of our program. I'm going to go through the off-service rotations first. So as first-year residents, as interns, just like many other programs, you'll do an OB rotation, as it's an ACGME requirement for graduation to get 10 deliveries. We do 2 weeks of OB. It's a really good experience, and it lets you get to know the OB-GYN consultants you're going to be talking to throughout the rest of your time at Rush, and I've really relied on those relationships and friendships when consulting them at other times, and the OB-GYN residents at Rush are incredibly nice. Opposite of OB, we do 2 weeks of anesthesia within that same month, which is a good opportunity to get down the basics of airway management in a controlled setting with a lot of backups, so you feel really comfortable trying to get your feet wet managing airways before managing more difficult airways in the ED. As interns, you'll also rotate in the medical intensive care unit with one of the 3rd-year residents on your team. This is a rotation we've changed somewhat through the early years of our program, and refining it and making it better. We're working in a new ICU where the EM team will be one of the primary teams taking care of patients, which is really an excellent opportunity for your ICU learning and training to be focused on what's important to an EM physician. As second year residents, we rotate in the MICU again on nights, which gives you the ability to kind of independently manage patients in the overnight setting when there's less resources around and you'll be making more decisions. Along with that, we also rotate in the pediatric ICU as second years, which is one of the best rotations in our curriculum. You will be on call every fourth day independently with an attending, making the decisions on all the patients in the pediatric ICU, which is a really excellent opportunity to gain confidence and independence in managing critically ill patients. It really makes you more comfortable managing pediatric patients. As second years, we also rotate through the pediatric acute care clinic to gain more pediatric experience, where you'll be taking care of urgent care type pediatric complaints. And we also rotate through the sports medicine clinics to get more comfortable managing musculoskeletal complaints, fractures, complaints common in sports medicine that you'll see frequently in the ED. In your third year, you'll rotate through the MICU again as the senior supervising the intern in that team that I had mentioned. In our third year, we do toxicology and addiction medicine as another rotation. You'll rotate with our 3 fellowship-trained toxicologists here at Rush and do some time working with the Toxicon, which is the Poison Control Center in the Chicago area. I'm also going to talk to you about the selective opportunities. Our program is incredibly flexible with selectives. Residents have done a huge variety of selectives, anywhere from any of the internal medicine subspecialties such as infectious disease, nephrology, heart failure. People have done palliative care, done radiology clinic, ophthalmology clinic, but people have set up some outside selective opportunities. There's selective opportunities within addiction medicine to have an additional focus with addiction medicine, and there's additional opportunities to get some more ICU experience as well if you're wanting to apply for a critical care fellowship track.